Did you know that when a doctor looks at your eyes, they're not just checking your vision? They're checking your liver, your heart, your kidneys, your brain. Your eyes are the only part of your body where blood vessels and nerve tissue are visible from the outside. And because of that, they can show signs of serious health conditions, sometimes months before any other symptom appears. In this video, we're going over 7 things your eyes could be telling you about your health right now. Some of these are easy fixes, some of them are urgent, and all of them are things you can check yourself right now at home. Let's get into it. Sign number 1. The whites of your eyes look yellow. The whites of your eyes are called the sclera, and they should be white. So if you're looking in the mirror and you notice a yellowish tint in there, that's something worth paying attention to. That yellow color happens because of a substance called bilirubin. Your liver normally breaks it down and removes it from your body, but when your liver isn't working properly from things like hepatitis, liver disease, or even a blocked bile duct, bilirubin builds up in your blood, and it shows up in your eyes first before it shows up anywhere else on your body. This is one of the earliest visible signs that something is going on with your liver. Now, not every case of yellow eyes is a crisis. Some people have a completely harmless condition that causes mild yellowing. But the rule is simple. If you notice it and it wasn't there before, get it checked soon. Liver conditions caught early are very manageable. The longer you wait, the more complicated it gets. Sign number 2, a white or gray ring around the colored part of your eye. Take a look at the outer edge of your iris, the colored ring in your eye. Do you see any kind of faint white or gray arc forming around it? In older adults, people over 60, this is pretty common and usually not a big deal. It's just a normal part of aging. But in younger people, under 45, that ring is actually a warning sign for high cholesterol. What's happening is that fat from your blood is being deposited into the tissue of your eye. Your cholesterol levels are high enough that it's literally showing up in your eyeball. And here's what makes this one tricky. Most people who have it feel completely fine. No chest pain, no headaches, no symptoms at all. That's what makes high cholesterol so dangerous. You don't feel it until something serious happens. If you're under 45 and you notice this ring, get a cholesterol test done. It's a simple blood test and it's worth knowing your numbers. Sign number 3, one eyelid suddenly drooping lower than the other. Quick check. Look at yourself in a mirror right now. Are both your eyelids at the same height? A very slight natural difference is normal for a lot of people. That's fine. But if one eyelid has recently started drooping, noticeably lower than the other, and it's new, that's a red flag. A sudden drooping eyelid on one side can be one of the first signs of a stroke. The nerve that controls your eyelid runs through your brain, and when blood flow to that area is disrupted, the eyelid drops. What most people don't realize is that this eye sign can actually show up before the more well-known stroke symptoms. Before the face drooping, before the slurred speech. It can be the very first warning. So if you or someone near you suddenly has one eyelid drooping, especially alongside any confusion, arm weakness, or trouble speaking, don't wait, call 911. With strokes, every single minute matters. Sign number 4, eyes that are consistently red, not just occasionally. Everybody gets red eyes sometimes. After a bad night's sleep, after staring at a screen all day, that's completely normal and it goes away. What's different is when your eyes are consistently red, week after week without any obvious reason. One thing that can cause this is chronically high blood pressure. When your blood pressure stays elevated over a long period of time, it puts stress on the tiny blood vessels throughout your body, including the ones in your eyes. Those vessels can swell and strain. You see it as redness. Nearly half of adults in the US have high blood pressure, and a large number of them don't know it because it causes no pain and very few obvious symptoms. It just quietly does damage in the background. If your eyes are persistently red and you can't explain it, checking your blood pressure is a good place to start. Home monitors are cheap and widely available. Sign number 5, the inside of your lower eyelid looks pale. This one requires a quick self-check. Gently pull down your lower eyelid just slightly and look at the inner rim. It should be red or deep pink. That color comes from the blood vessels right at the surface. If it looks pale, light pink, or close to white, that can be a sign of anemia. Anemia basically means your blood isn't carrying enough oxygen around your body. Your red blood cell count is low, or your red blood cells aren't working as efficiently as they should be. The symptoms, feeling tired all the time, brain fog, always feeling cold, are so vague that most people just chalk it up to being busy or stressed. They never connect it to a blood issue. A simple blood test can confirm it, and for most types of anemia, treatment is pretty straightforward once you know you have it. Sign number 6. Your pupils are two noticeably different sizes. Look at your pupils, the block circles and the center of your eyes. Are they roughly the same size? A very small difference is actually normal for about 1 in 20 people. If you've always had it, it's probably nothing. But if your pupils are suddenly noticeably different in size, and this is new for you, that's worth taking seriously. Your pupils are controlled by your nervous system. When there's pressure building inside the brain from a bleed, an injury, or in some cases a tumor, it can affect the nerve that controls pupil size on one side. One pupil dilates and stops responding to light normally. This is actually one of the first things emergency doctors check after any kind of head injury. They're not checking your vision, they're checking your brain. If you notice a new significant difference in pupil size, especially after a head injury or alongside a headache or vision changes, don't wait. Call 911. With strokes, every single minute matters. Sign number 7. Puffiness around your eyes that doesn't go away. A little puffiness when you wake up in the morning, that's normal. It usually fades within an hour. What's different is puffiness that sticks around all day, every day, for weeks. Persistent swelling around your eyes can actually be a sign that your kidneys aren't filtering properly. Here's why. Your kidneys are responsible for keeping the right balance of fluid and protein in your blood. When they're not working well, protein starts leaking out. And without enough protein in your blood, fluid shifts into your tissues instead of staying in your bloodstream. The area around your eyes has very loose, thin skin, so it's one of the first places that fluid buildup becomes visible. If you've had persistent under-eye swelling for more than a few weeks, especially if you've also noticed swollen ankles or changes in how often you urinate, that's worth getting checked. Kidney disease tends to be silent until it's advanced. Catching it early, it makes a significant difference in how it can be managed. So, those are 7 things your eyes could be telling you about your health. Now, before you start worrying, here's the most important thing to remember. One sign by itself doesn't mean you have a serious condition. A lot of these can have very simple, harmless explanations. What matters is change. If something looks different than it did before, if you notice something new, that's when it's worth paying attention. Your body gives you signals. The problem is most of us were never taught what to look for. Now you know what to look for. So take 30 seconds, look at your eyes in good light, and if something doesn't look right, just get it checked. That's all. Most of the time, it'll be nothing, but sometimes it'll be exactly the thing that needed to be caught. If this was useful, hit the like button and subscribe to EyeVault. We cover eye health and vision science in a way that actually makes sense. Which one of these surprised you the most? Let me know in the comments below. See you in the next one.